Hello, everyone. Welcome to Empower Echoes, where we turn inspirations into great impact. In today's video, we'll be talking about borderline personality disorders. We heard that before, right? So during the week, someone reached out to me and said, Abigail, can you talk about borderline personality disorders? And although I have knowledge about personality disorders, however, I had to do, extensive research to know more about it. During my findings, I saw things that were eye openers, you know, about things I never knew about some borderline personality disorders. Now, for the sake of this video, I will be referring to borderline personality disorders as BPD. All right. Now, epidemiological studies indicate that borderline personality disorders, otherwise known as BPD, affect 1% of the world population. All right. And studies have also shown that uh, borderline personality disorders coexist with other mental health conditions. This is what really caught my attention. And you know me, I am very fascinated with anything that has to do with mental health. So, borderline personality disorder coexists with other mental health conditions such as anxiety disorders. I've talked about anxiety disorders, and the chance of someone who has borderline personality disorder having anxiety disorders, according to statistics, is 80% chance. That's very high. All right, and then it also coexists with depression, which it can be between 50 to 70% chance of someone having BPD to also have depression. All right, and also you see mood disorders. This is statistics is quite unbelievable. All right, so I've also talked about mood disorders, so you can check that out for more information. Now, according to DMS, and that means diagnostic statistics manner of mental disorders. According to them, they've um, characterized or classified BPD as a personality disorders. All right, I'm sure personality disorder is very familiar. We're familiar with personality disorders, and borderline personality disorders is a global issue. Now, if something affects 1% of the world population, then it's a global issue. That brings me to the very big question: what is borderline personality disorders? Borderline personality disorders is, characterized by, that pervasive uh, instability in one's mood, in self-image, in relationship, and in, behavior. People with borderline personality disorder often experience a rapid and swift change in their emotions. It can be very difficult for them to regulate their emotions. Their emotions can range from from low to just an extreme change. If you have seen someone with living with someone who has regular mood swings, it's related to, similar to what people living with borderline personality disorder experience. Their mood can range from extreme anger to extreme fear, which makes them feel unstable. Now, I'll give you a description of what living with borderline personality disorder looks like or feels like. When you are on a roller coaster, riding on a roller coaster without a seat belt, you can imagine how the highs and lows of it will make you unstable. So with the highs and lows in emotion of people living with borderline personality disorder, it makes it very difficult for them to regulate their emotions, and it makes them feel so unsafe. This is no place anyone should be in. However, it's not the end of the world. You are not alone. Living with borderline personality disorders is not the end of the world, and you're not alone. There are treatment plans for it. And according to research conducted by DMS, the fifth edition, it said that people living with borderline personality, after undergoing treatment for 10 years, they no longer meet the criteria for borderline personality disorder. So they totally recover after going through treatment for 10 years. All right, so that is hope. I totally understand how these can affect your relationship, because it really affects their relationship, because it's always difficult for their partners to be able to navigate between their different moods. And that's why they experience unstable relationship even with their partners at work. It makes it really difficult for them even to maintain a particular job. Living with borderline personality disorders is a struggle, but then there is hope for you. There are treatment plans that you can undergo that can help you. All right, how do you cope with living with borderline personality disorders? Number one, you have to create a strong support system. And when I mean a strong support system, you need your you need professional help. You need the help of a therapist, because they will be able to guide you through dialectical behavioral therapy, or cognitive behavioral therapy, which helps you to identify the root cause, and they can create plans and treatment plans that can help you live a normal life, that can help you manage your symptoms. All right, so you can't do this journey by yourself. All right, you need the help of a professional therapist who is specialized. And it's not just any therapist, but a therapist who is specialized in dialectical behavioral therapy or cognitive behavioral therapy. You also need to lean on the support of your loved ones at this time. If you have anyone with living with BPD, you have to support them. Although you have to be able to draw the line, you have to be able to set boundaries, but they need your support. They need constant reassurance that all will be well. They are just having a bad day. It's not the end of the world. All right. So if you have anyone around you who struggles with borderline personality disorders, you just need to give them emotional support. You need to give them assurance that all will be well. Okay. And you also need to identify your triggers. When you identify your triggers, you'll be able to develop strategies to manage your triggers, or to be able to develop the right responses to your emotions. Remember, I started by saying there is always highs and lows in their emotions. It makes it very difficult to regulate. So, but when you identify your triggers, you'll be able to you'll be able to create the right response to your triggers. Okay? Another way to be able to manage or cope with borderline personality disorders is to be able to, you know, self-care, practice self-care, do exercise, do your hobbies, do things that makes you happy. As an individual, there are some days that I wake up not in my best mood, but I constantly remind myself, Abigail, nothing is going to bring you down. When I get probably to walk out or anywhere, and I see things that wants to ruin my day or my mood, I keep telling myself, no, baby girl, no, nothing is going to bring you down. You have to be deliberate. You see, even with the medications and the help of a therapist without you being deliberate and making sustainable efforts to help your situation, it won't work. All right, so you have to do things that makes you happy, exercise, do things that naturally helps you reduce stress, because stress is a trigger. Do things that naturally helps you reduce stress, and things that boost your moods. Like for me, nothing boosts my moods like shopping. I shop for free. I help my friends and loved ones to shop for free. Going to the maybe supermarket, shopping, I can never be upset. Nothing can bring my moods down. All right. And as an individual, I understand that because I also struggle with mood disorders. I understand that I can't be shopping for myself every day. I'm going to go bankrupt. But then it's fun doing it for my loved ones or friends, so I don't mind. I offer to do it. I'll go for your shopping. All right. So do things. If working out helps you, makes you happy, do it. Whatever, do your hobbies and things you enjoy to do. It will always help you to be in a lighter mood and helps you to keep your emotions in check. All right. So that's another thing. Last thing you need to do, that's not all, but just a few that I'm telling you, and I'm just saying in this video, is that you have to be patient with yourself. You need to understand that recovery is a journey and setbacks are part of the journey. So don't be too harsh on yourself. Celebrate every step to positivity. Celebrate every step to possibility. You can always practice gratitude. Like I advise, have a gratitude journal where you always write things that you're grateful about on daily basis. All right? It is a journey. You are going to be fine. It's okay, absolutely okay to have some bad days, but trust me, your determination to positivity is all that you need. Stay strong. I would, in the description, I'm going to drop online resources that you can use, you know, for consultation for everyone going through borderline personality disorders. I love you. You are the best version of yourself. All right. Stay positive, stay blessed. And to all my viewers, stay out of trouble. All right. And you know, empower echoes will create inspirations that impact. We educate people about different mental health issues that can daily affect them. And my joy is to make sure, is when I see that you're using these tools that I'm giving you, you're making the best version of yourself. Stay positive till we see again in our next video. I love you all.